What is Allen's test? Allen's test is a procedure done to assess collateral blood flow before drawing arterial sample in arm. It was named after Edgar Van Noyes Allen, which was later renamed as Modified Allen's test after Irving S. Wright revised its method. This is how a phlebotomist performs Allen's test. First, acquire a requisition slip. This contains the patient information and their requested test. Next, introduce yourself and identify the patient. Remember that correct patient identification is the most important step in any procedure.
Right this way, sir.
These are the things you need for Allen's test: gloves, towel, and alcohol. Explain the procedure to the patient. This way you give him reassurance. Prepare the materials. Proceed to clean hands with alcohol and wear gloves before proceeding to palpate the patient. Instruct the patient to place hand in palmar position above the towel. This hyperextends the wrist. Use your index and middle finger to palpate. Since the thumb has its own pulse, using it is discouraged. Locate radial artery. Then proceed to locate the ulnar artery. Compress both arteries for 30 seconds and instruct patient to clench fist. Have the patient to open the fist and observe the palm become pale. Release pressure on ulnar artery and observe return of color within 5 seconds. Here is how a negative and positive Allen's test looks like. Record results. A return of color within 5 seconds is positive, while greater than 5 seconds is a negative result. Lastly, thank the patient. Let's talk about POCT. POCT is performance of laboratory tests done at patient side rather than the central laboratory. One useful POCT instrument commonly used is the glucometer that measures blood glucose levels. Usually, a glucometer kit contains a lancet device, glucometer, glucose test strip, a manual, and lancet. It is important to know history and last meal of the person to be tested. This is how you perform using glucometer. Make sure you clean hands with alcohol before putting on your gloves. Remember to avoid the following fingers as collection site for these following reasons. It is suitable to collect from the ring and middle finger of the hand. After choosing the preferred site, clean with a cotton swab inner to outer and allow to air dry. Proceed to prepare the lancet device by inserting the lancet and twisting its lancet cover. Make sure to cap it securely. Prepare glucose test strip and insert it to the glucometer. Don't forget to check its expiry date. Make sure to prick finger in these areas just off the middle, perpendicular to the finger grooves. This produces a round drop of blood. Wipe the first drop as it contains alcohol residue, interstitial fluid, and dead skin cells. Gently squeeze finger and allow blood to flow into the test strip. Instruct patient to gently apply pressure. Make sure to safely get rid of sharps. Discuss result to patient. Range for normal blood glucose is 60 to 115 mg per deciliter. Return materials to its container and get rid of gloves. Lastly, thank the patient.